Hello, my name's Jane and I'm a physio specialist at Warrington and Halton Hospital. These are my colleagues Ravi Badgay and Akash Ganguly, who are consultants at the Trust. In this video we'll talk about adhesive capsulitis or frozen shoulder, who it affects, how it presents and which treatments are available. This is Mark, a patient at the Trust who will help demonstrate. Adhesive capsulitis or frozen shoulder is a painful condition characterised by progressive loss of shoulder movement. There will often be nothing seen on an X-ray or ultrasound scan. This condition commonly affects people between 40 and 65 years of age and is much more common in people with diabetes and thyroid problems. Up to 20% of people with frozen shoulder will be diabetic. Women are more commonly affected than men. If you are diabetic, it's important that your blood sugars are well managed in order for you to give your shoulder the best chance of recovery. Sometimes frozen shoulder can come on for no apparent reason, and sometimes it can happen following an injury or operation involving the shoulder. In the early stages, the shoulder can be very painful as a result of inflammation of the joint lining and capsules surrounding the shoulder joint. This then progresses to the formation of adhesions and fibrosis, causing the capsule to become stuck together and more rigid. The most difficult movements are often reaching out behind your back and reaching up. It can often be very painful when trying to get comfortable in bed at night. Frozen shoulder can be a very painful condition, and shoulder pain and stiffness can last anything from 5 months to 3 years, and sometimes longer. There are several different treatment options available to help reduce shoulder pain and restore range of movement. In the early stages, your GP might prescribe you painkillers or anti-inflammatory medications, and even a steroid injection into the shoulder if your pain is too severe to exercise. It's important that you start physiotherapy as soon as possible. This could be doing some movement exercises and strengthening exercises yourself at home, in the swimming pool or in the gym, or go into the physiotherapy department for some guided exercises. Sometimes the physiotherapist will perform some mobilisations on your shoulder to try and restore some of the movement. If your pain is very severe and you are struggling to get your shoulder moving, you could be offered a course of hydrotherapy in the specialised pool in the physio department. Here are some of the exercises you could try to get yourself started. Table walkaways, resisted external rotation with a hand weight, abduction with a pole, and hand behind back with a towel. It's okay to exercise into pain as long as when you finish the exercise, your pain returns to normal levels and isn't worse the next day. Often people do very well with the first stage of management we've described, but if your pain and stiffness persists, you'll be referred to the orthopaedic department at the hospital for further management.
If your shoulder pain and stiffness persist, you will usually be referred to us, the orthopedic team at the hospital. It might be your physio, GP or MSK CATS physiotherapy specialist who send you to us. One of the orthopedic team will discuss your shoulder symptoms with you and find out about the management you had so far. Your shoulder range of movement and muscle power will be examined and your diagnosis will be confirmed. If you have not had an up-to-date X-rays, you will probably be sent for one at this stage.
You might be offered a hydrodistension injection where appropriate steroid and fluid are injected into your shoulder by a trained radiologist in the X-ray department. Your shoulder might feel a bit sore for a couple of days before it gets better. You'll be encouraged to continue with your shoulder exercises as soon as you can after the injection to give you the best chance of making a full recovery.
Managing frozen shoulder is a team approach, and some group of patients respond well to the non-operative treatment mentioned earlier, but some may not. If the initial physiotherapy and hydrodistension not worked in the first instance, then that could be repeated. But if your symptoms persist, then operative intervention in the form of manipulation of the shoulder under anesthesia or keyhole surgery would be discussed with suitable group of patients. The keyhole surgery is done as a day case. You don't have to stay overnight in the hospital. This involves releasing the scar tissue and adhesions around the shoulder joint to improve the range of movement and reduce the stiffness. The anesthesia we use during this procedure would allow you to move your shoulder straight after the procedure to maximize the chances of regaining the movement achieved during the surgery. As soon as you can after the operation, you are advised to continue with your physiotherapy exercises to make sure you give yourself the best chance of a good recovery.